All right. Well, good afternoon, everyone. It is right at 1 o'clock, so we want to be timely and respect everyone's time. We thank you all for joining us. We're about to have our second webinar with one of our vendors, and today you're going to be hearing from Achieve Health Management. Just wanted to frame it before they get started, that they will be answering questions throughout the presentation, and afterwards, there are representatives from TEA on this call, from Achieve Health Management and Dishes. And so we'll be here to answer questions and provide you guidance. If we cannot get to your question or do not have a specific answer, we will be sure to get back with you this week. So at that time, if there's nothing else further, I will turn it over to our Achieve Health Management folks. So you guys can come off of mute and we'll turn it over to you.
Good afternoon, all. Appreciate your time today. Charles Parks. I'm the Chief Executive Officer of Achieve Health Management. Appreciate your time this afternoon. For some reason, my camera's not able to work right this moment. Apologize for the technical difficulties. So on the call today, we're pleased to have two of our partners, one of which is Informed Diagnostics Laboratory managers. And then in addition, Crisis Go, who has some fantastic software for results reporting and then also managing lives inside the school system. They directly integrate with SISs.
Mr. Parks, let me, if I can interject, we've enabled you to be able to share your screen. So I don't know if you had a slideshow or anything.
We do, yes. We're working on that right now.
Okay, I just want to make sure you were good. Okay, go ahead, sir. Sorry.
Okay, doing it right this moment. One moment, please. Is it possible that we can make Cameron Parks the presenter who's attending as well?
Yes, sir. We'll do that right now.
Okay, yes, thank you.
Cameron should be good to go now. Cameron, are you able to share your screen?
It says host disabled participant screen sharing.
Go ahead now. I made you a co-host. There we go. And we can now see your screen, sir.
There we go. So again, Charles Parks, CEO of Achieve Health Management. On the call today is Patty Sipes with Informed Diagnostics. They have a very large and state-of-the-art laboratory up in Irving, Texas. And then also Jim Spicuzza, Chief Product Officer for Crisis Go. And then we'll also hear from our Chief Medical Officer, Tad Lazarus, who's a 25-year veteran in diagnostics. We're pleased to be affiliated with this group. We're one of four entities that won the award from Texas Department of State Health Services, and also pleased to be working with the Texas Education Agency, and of course, all the schools and districts across the state. Just briefly, a little background on our company. What we are is we're a clinical service company. We've done this for over a couple of decades. We work with health insurance companies across the United States, and we employ a very large team of nurses and physicians and pharmacists. When COVID came about, we were uniquely poised to enter the testing space. We are an authorized distributor for a number of different manufacturers for COVID-19 test kits. What we offer is a comprehensive service for schools. And so whereas we provide staffing, we'll help you establish a testing plan. We'll come on site, we'll collect samples, and then the results will be reported back through our online portal. The results are reported to DSHS, and then also they're available through Crisis Go. So we won't go into much detail on this, but if any of the districts are interested, we can meet with you offline, and we can help establish a testing program that makes sense for your district. What we found in working with hundreds of districts across the United States is that each one is unique. We know the market in Texas, and that's even a little bit more unique than others. Whereas the state is providing the funding for the PCR and the rapid antigen testing. This is just a very fundamental workflow of what a testing site would look like. And what we try and emphasize here is that there's safety and social distancing. Who's ever being tested would pre-register, then get prepared for the test. It literally takes just perhaps 1 minute. At this point, I'm going to turn it over to our Chief Medical Officer, Dr. Lazarus, and he can talk about the two types of samples that we collect on site. Dr. Lazarus?
Yes, hi. Nice to be here with you. Anterior nares is the very front opening of the nostril. It takes about 15 seconds per nostril, 3 or 4 turns, and then just holding it in place for a few seconds more. We found that from across the age spectrum, from
I think Dr. Lazarus may be having a technical issue as well. So what we do is we use anterior nares. I think everybody's seen the big long swabs that you've seen on TV where they go very deep in the nasal cavity. We use an anterior nares sample. We just place it at the very tip of the nose, hold it for 15 seconds and rotate it. And that's enough that allows the laboratory to have enough RNA to get a valid sample. And then in addition, we provide saliva collection kits, which can be used for some of the older people that we sample. We found that saliva does not work very well with young children, as they don't really produce enough material. There's 3 different types of COVID tests. And what we do is we work with the PCR test. It's 100% sensitivity, 100% specificity. Those samples are collected on site. They're sent overnight to our laboratory in Dallas. And then results are reported typically within 24 to 48 hours.
Charles, can you hear me now?
Antigen test. And those are used on site. We offer Abbott Binex Now, and then also a product called GenBody. GenBody is equal, if not greater than the Abbott product. And it's right now there's a run on Abbott products, so we're able to get that a little bit quicker. Results reporting, what is a negative test?
Can you hear me now?
Means that you're not carrying the virus.
Charles, can you hear me?
So again, this is really Dr. Lazarus's area, and for some reason he's not able to get on the call.
Hey, excuse me, Charles.
So at this point, I'd like to introduce Patty Sipes, Chief Commercial Officer of Informed Diagnostics. Patty?
It sounds like Charles can't hear anybody else, but we can hear everybody else.
Yeah, so if Dr. Lazarus or Charles
Well,
want
it
to
doesn't
jump in.
appear Patty was able to get through as well. I'm not certain what the technical issues are here, but Informed Diagnostics, we've worked with these guys for a couple of years. They're based in Irving. They have a beautiful facility. I've been to the facility myself numerous times. As you can see, they do about 1.3 million samples on an annual basis. They have 4 laboratories, the primary one being, of course, in Irving.
Hello, Charles. Can you hear me? This is Patty.
They offer COVID testing as well as pathology and a number of other types of diagnostics. With Inform, we talked about this. Results are available within 24 to 48 hours on PCR testing. What they do is they extract RNA from the virus. They use Thermo Fisher Quant Studio equipment, and indeed their laboratory is very impressive. They also offer very quick turnaround time. We do tens of thousands of samples each week with Inform, and their typical turnaround time is about 21.6 hours.
Hey, Charles, can you hear me? Charles?
So at this point, we're going to turn it over to Crises Go and allow them to talk about their great software and how it integrates with the school information systems.
Is there someone from AIM that can text Charles and tell him that we can hear everybody else, but for some reason he can't?
Yeah, Cameron, can you do that?
If this is Dr. Lazarus, if Cameron's not on, I'll do it right now.
And this is Patty Sipes. I sent him a message as well.
Okay, can you hear me now?
We can. Can you hear me?
Yes, we can.
Yes.
Okay.
Okay.
Apologize for the technical issues here.
No,
Yeah.
no worries. So did you guys want to go back and cover the specific
Yes, please.
things that? Okay,
If we could, that would be great.
Thank
okay.
you.
Whoever has the control of the PowerPoint or the presentation, if they can go back a couple of slides, and then whoever needs to pick up, you can.
So, Dr. Lazarus, I think we should go back and talk about the differences between PCR and rapid antigen testing.
That makes sense.
Okay, thank you. Dr. Lazarus.
Hi, it's my pleasure. Could we go back up one more slide, please? Again, great to be with you. I'm glad we could solve the technical problem. I put in really all three, and I asked to have these 5 slides put in because I thought perhaps maybe it might be a ready reference source for you all into the future if you might want it. PCR is something I've worked on since Roche got the patents from Cetus Corporation. I was one of the first docs in the country to work on the clinical applications for it in the early 90s. PCR has been likened to finding a needle in the haystack. Instead of looking for one needle, you multiply it 1,000,000-fold. So it's completely specific to the nucleic acid sequence, and that's what makes it so incredibly sensitive. The antigen tests are the rapid antigen tests, and just to get to the heart of the matter, when they're positive and the patient's symptomatic, they're really usually positive. When they're negative and the person is symptomatic, you really can't trust that it's negative and you have to do a PCR test. And those are the rapid tests that take about 15 minutes, the antigen tests. Serology tests are different. They're blood tests, and they look for antibodies that your body makes in the presence of the infection, both early and late antibodies. There's a new generation of tests also coming out that are super selective, and they tell you or tell the doctor if you've had the infection naturally or if you've received the vaccine or you've had both. So these are the 3 different flavors of what goes on in the laboratory. The thing about antigen tests in general is that they take longer to show up as positive after people have had a serious contact and are indeed positive. And as I said before, they have many false negatives. And so if a person has a very good chance of having had a very close contact or is symptomatic and they're negative, you really have to go on to the PCR test. Next slide. Again, PCR, antigen, you can use the anterior part of the nostril, I think most effectively. Serology is blood. What does a positive test mean? And I thought it would be great to spend a moment on this. So if it's a PCR test, a positive PCR test means that the person being tested has the virus. And it's really, with the technology that we use, the chance of it being a false positive, it approaches zero. And people who first test positive should isolate for a minimum of 10 days after symptoms begin. And they have to be without a fever for at least 24 hours after symptoms improve. The antigen test, a positive antigen test, means that the person being tested has the virus that causes COVID-19. So it's the same kind of quarantine and waiting at least 24 to 48 hours after people no longer have symptoms. Could I have the next slide? Now, what does a negative test mean? And I just thought I'd go through this again quickly because it kind of puts into perspective what positive and negative mean. So a negative molecular test, meaning a PCR test, it means that the virus was not detected, but it doesn't rule out infection prior to the virus being at a detectable level. So when in doubt, quarantine. You can see at the bottom even that the CDC recommends that fully vaccinated individuals who remain symptom-free do not need to quarantine, but should get tested for COVID-19 3 to 5 days following an exposure and wear a mask in public indoor settings for at least 2 weeks or until they receive a negative result. Now, a negative result for the quick antigen test means that the viral proteins were not detected. It doesn't rule out infection prior to the virus being at a detectable level. So if there's still a concern that a person has COVID-19 after a negative rapid antigen test, then that person should be tested again with a PCR test, and they should continue a full 14-day quarantine. Now, in school systems across the country, people, as you know, have developed various methodologies of test and stay in place, but there is no actual CDC ruling on that in terms of the data that's been gathered to actually say that that is an approved methodology. But it's something that many are doing now, as I think you know. Next slide. So I just wanted to show these to you. Now you can go to the next slide. And there's a lot of stuff there, but you can see it's kind of like one-stop shopping. It was recently updated in August 10th, and I thought it might be a very helpful and concise guide to you to kind of clear up rapid antigen from PCR, from antibody testing. To be perfectly honest with you, from the point of view of someone who's worked in epidemic and pandemic response my whole career, I think it makes so much more sense in general to do the PCR test with the little swab at the front of the nose. In the old days, when testing took 14 days or 11 or 10 or 9, you wanted to know more quickly, and we would look for that. But now, with getting it back within 24 hours, it really changes the role of PCR. And remember, in my explanation of rapid antigen, I gave you all the decision points where you still have to go and do the gold standard, the PCR test. So I hope that this has kind of helped to differentiate between PCR, the rapid antigen, and serology, looking for antibodies. And of course, at any time, I'm happy to speak with anyone in greater detail. Thank you, Charles.
Thank you, Dr. Lazarus. I'm going to jump in real quick. Diane from Dishes has her hand raised. Diane, did you want to share something?
Yes, can you hear me okay?
Yes, ma'am, we can hear you.
Okay, so I wanted to provide clarification on 2 points. The discussion was just about serology That's available from AIM, from Achieve Health Management, and that is not an option. That's available to the schools in Texas. And then earlier, Charles had made a comment about saliva collection, and that is not available for testing either. I just wanted to put those two things out there. Thank you.
Thank you, Diane. We'll turn it back over to Charles or whomever else was next from you all.
Yes, thank you. Next up would be Patty Sipes from Informed Diagnostics.
Oh, can everyone hear me okay?
Yes, we can.
Wonderful. Hello, I am Patty Sipes. I'm the Chief Commercial Officer for Informed Diagnostics, and I've actually been in the healthcare industry for 30 years. Informed Diagnostics was formed 25 years ago and has become one of the largest independent pathology labs in the country. The key to our success is truly our quality, and our concordance rate is one of the highest in the industry. In fact, it's 99%. So what does that mean? That means if a patient asked us to send their tissue sample to another laboratory for a second opinion, it's common. I think anyone who's had a tumor or something removed, they like second opinions. So if they were ever to send it to someone else for a second opinion, that the other physician would agree with our diagnosis 99% of the time. So that's outstanding. That means that we get it right, and we get it right the first time. And we're very proud of that fact. Our team is very large, and our physicians can speak with an expert at any time, which is actually pretty uncommon. This commitment to communication with our clients truly makes us top in our field. The type of accuracy, is outstanding. And we do service the entire United States and do over 1 million pathology tests annually. There are 4 locations throughout the United States as well, with our headquarters being in Irving, Texas. Next slide. Our primary business is the diagnosis of cancer. So we typically diagnose cancer. However, please know that we might tell someone that they do have cancer. We could also tell them that they don't have cancer or that they have gone into remission. So there's also good news that comes with what we do. However, we do have a team of over 50 pathologists, and each one of those pathologists has an expertise. So the reason why I even show this is to show just the level of commitment we have to this testing. If someone has a mole removed, a dermatopathologist is the one reading it. It's not going to be a general pathologist. It's going to be someone who only looks at that all day long. Same with if someone had a polyp removed in a colonoscopy, there would be a specific pathologist assigned to that individual so that we make sure that they see it every day, they see it all the time. And it's almost like Waldo. If you don't know what it looks like, it's hard to see. But once you do know what it looks like, the red hat, the white, then it's easier to find it. So they say cancer is pattern recognition. So whereas Waldo is a common item that we utilize just in mentioning it. So what we did at the onset of the pandemic is we chose to add COVID testing to our menu so that we could help the community. It was similar type of equipment that we needed for the other specialties. It was something that we could add, and we wanted to do it to help the community because we needed every single testing entity possible, and we needed to get that turnaround time. Next slide. Our COVID-19 test is run by an expert team of molecular technicians and physicians. We work around the clock to ensure that every patient can receive their diagnosis within 24 to 48 hours of receipt of the sample. This is very important. Dr. Lazarus mentioned before there was getting turnaround time that was quite long. By the time you received your result back, you were feeling much better and you probably didn't have COVID anymore. So we are fast and our science is state of the art. We understand how uncomfortable it can be for patients to have samples collected. So because of this, we do offer 3 types of collections. You just noted that the saliva is not. So it is now available in this particular setup. However, the company does make it available. And lastly, we are local. All samples will be sent straight to our laboratory in Irving, Texas. In many cases, they'll be driven here. So we are thrilled with that. You would have a Texas company handling your specimens. We're very proud to be partnering with Achieve and look forward to meeting with many of you in the near future. The next slide shows my contact information. If you have any questions, please feel free to reach out to me directly. Thank you.
Thank you, Patty. And folks, the laboratory is very impressive. And the quality of work, we work with a number of laboratories. Inform is a perfect match for us in Texas, and they just do outstanding work, and service is unparalleled. So in this comprehensive offering, We're pleased to have the folks from Crisis Go partnering with us in the Texas initiative. And Crisis Go is integrated with most SISs, and they're integrated with the Achieve Health registration and scheduling and results reporting application. So Jim Spacuzza is on today, and he's going to talk briefly about this value-added service that comes with the Achieve Health Management Program. Jim?
Hey, thanks, Charles. Can you hear me okay?
Yes.
Very good. Next slide, please. First of all, a little bit about Crisis Go. We've been in the school safety business for 8 years now, all over the United States, 16,000 schools in multiple countries, working with school districts. And in 2020, as we saw COVID hit, many of our school districts required a set of tools that could help them deal with that. And so we pivoted and worked with them. Next slide, please. So we started out with pre-certification, emailing parents and getting students met a physical condition prior to coming to school so that they could enter. We validated at the door. We allowed for monitoring, escalation, and tracing. And then as things changed and things became more difficult, we started with vaccination, testing, and modified quarantine management. Next slide, please. So for test management, we started this partnership with AHM, and it has been absolutely phenomenal. We integrate with them, and we bring in from the student services SIS and also the directory services, the student and staff ID and first and last name into the registration portal and to the lab. This allows us to get results back by student in the building that they're in the way that school districts are used to seeing it. Permission managed and easy to understand the results in near real time when the lab publishes the results. Next slide. So to start, we have a single registration that goes out, form driven by email out to staff, as well as to parents, guardians of students, so that they can go ahead and consent to the actual registration and go ahead and complete the forms. Next slide. So once everybody gets registered and tests start to be taken, the results are through our API are delivered into Crisis Go and framed up, as you can see here, by building, allows you to manage it by the grade level, by all types of test results, positive, negative, etc. Next slide. And you're going to probably have other tests that you need to add into your system, manual test results from Walgreens or some pharmacy. And so we provide you the methods to be able to add this into each one of your facilities so that you can keep track of all test results. Next slide. As you can see here, you can quickly and easily select the positive cases, the negative cases, go through. You can look at this by date. You can look at this by building, etc. Obviously, everything is permissioned by building and split between staff and student, for the type of permission management that we know schools need. Next slide. We provide you with a variety of dashboards to look at test results over time, as well as test results over the last 2 days. And you need that particularly when you're running modified quarantine types of programs or test to stay programs. Next slide. If you choose to use vaccine management, Crisis Go has that also built in. There's no need to choose to use this tool, but if you do, next slide, it's a very simple form-driven email out to staff and or parents for them to complete their vaccine information and submit it to the system so that particularly as you're managing quarantine, you understand those that have been vaccinated might have different rules applied based upon the CDC versus those who haven't. Next slide. If you choose to use CrisisGo for contact tracing, if you don't have a tool set already, CrisisGo goes ahead and helps you by providing the ability to look at information by sections. So if we go to the next slide, please. You can see here that David Silver actually became COVID positive, and we wanted to recognize all the people that were in the same school section. So we're able to choose sections for David Silver, identify the 8 classes that he was in, and quickly and easily pull up all the associated students and staff members that could have been in close contact with him. Next slide. Once we've identified those students, we have tools for batch management of cases, of close contacts, of symptomatic students. And through this system, you can apply a quarantine and an associated case quickly and easily to everybody at one time. Again, just making what sometimes is often a one click at a time type of tool into a really fast and effective tool to manage your quarantines and to make sure that people are associated with the right close contacts. Next slide. So as you see on the right-hand side here, you can see the status of an individual with all of the data associated with them. So everything from their vaccine status to their last test result, to their entry badge, if you're running that, and their symptoms, etc. All in one place, nice and easy, and in a dashboard in which you can actually make quick decisions. Next slide. As well as you get to see the operational history log. So Leslie Alexander here actually performed a function of marking this person as a close contact of Robert Fox. So the documentation is there for every step that you take within the system to provide the reports that you need. And remember that if you have a need to ingest this data into other systems, CrisisGo provides the tools to help you do that. Next slide. Back to you, Charles.
Thank you, Jim. Thank you, Patty. Thank you, Dr. Lazarus. That covers our session for today. And at this time, if anyone has any questions, we'd like to hear from you. And we have a team of subject matter experts here in the meeting, and we can respond accordingly.
Charles, this is Diane Romness. And I see on the slide that's on the screen right now that you have a phone number. And so that was not published on the vendor spreadsheet. Is it okay if I add that phone number, that 618-ACHIEVE?
Yes, please. Thank you,
Okay.
Diane.
Thank you.
Thank you for that, Diane. Okay, so Charles and everyone else from Achieve Health Management, if you're okay, I'll go ahead and start reading off some questions. And then you all also, if you want to click on the Q&A chat feature or the Q&A feature, you can also see the questions as well. Okay.
Yes, sir. Thank you.
So no problem. So the first question says, for those of us who are currently using the Abbott Bionex Now test, when can we expect to receive our first shipment? So meaning if they reached out to you all for that.
So in our arrangement with DSHS, there's 2 products, Abbott Bionex Now, and then also a product called GenBody, which clinically is perhaps even a little bit better. And so Jeff Williams, who's on the call, is processing orders now. And we do plan to start shipping GenBody this week. And we're still waiting to hear back from Abbott because they're allocating. However, there is good news associated with Abbott is that they're prioritizing schools across the country. And so we have several large orders that are now being processed. And we should hear back more today on the Abbott Bionex Now product.
Perfect. Thank you, sir. Next question. When you all mention or you say older, do you have an age range you prefer? Right? I'm assuming they're talking about the different testing. So that's the question. When you say older, do you have an age range that you prefer?
That was relating to saliva, and DSHS wants to default to anterior nares, so there would be no age limitation. And just So it's very clear. Anterior nares is really the preferred method. It's much quicker. It literally just takes 15 seconds. You hold it and then you rotate it on both nostrils, and it's not uncomfortable at all. But saliva has been rolled out for this particular program.
Got it. Thank you, sir. Next one, will you provide a signed agreement to follow the testing plan to come to on site with your staff to collect samples and provide results? Is this COVID testing a clinic on site?
Yes, we're operating under a master services agreement through Premier GPO and DSHS. So we're a Premier member. They're a large group purchasing organization of about 4,100 hospital members. We provide testing services to their membership, of which DSHS is one of their members. But we do have a very fundamental agreement with a statement of work that outlines the testing plan that we build on a case-by-case basis with each district.
Got it. What is the difference between Abbott by Next Now and Gen Body? So if you all can just review that again or distinguish that for them.
Dr. Lazarus, can we hear from you on that, please?
Yeah, they're both rapid antigen tests. I would say overall, it appears to me that the performance of GenBody is better in terms of sensitivity, but they all operate the same way, plus or minus. I see somebody asked, will I have to get retrained? And yeah, there are differences between the two of them, but in terms of training and level of comfort, probably about a 5-minute time endeavor if you switch from one to the other.
Damon, I have a question for Chief. So we had asked you guys if you could do a process information about the type of test that you have. Like if, for instance, if Abbott by Next Now, if there's 5 steps and these are the steps, and then for GenBody, there may be 7 steps and the PCR, just so that it's from the collection site to from the collection time to when either you ship it off to the lab or the results are available. Do you have that information?
Yes, Diane, Dr. Lazarus and I will work on that with Patty from Informed Diagnostics, and we'll get that over to you.
Oh, I was hoping that you could talk to the schools about that information.
Okay.
To the people on this webinar.
So, Dr. Lazarus, with there's subtle nuances between the Abbott by Next Now and the GenBody test, and I would think the methodology though would be pretty much identical. I imagine there would be staff associated with that. What's your opinion, sir?
Yeah, the beginning and the ends are always the same in rapid antigen tests. They always start with a good anterior nares collection, and they always end with waiting for a color change to come up to see if it's positive. And they all always have a control strip that always has to be showing there. Otherwise, it's an invalid test. So they're all really the same in the beginning, the end. They have just a few subtle differences in terms of how they like you to wet the swab and how they like you to provide moisture to the area that has the color change. But they're very subtle and really nothing difficult at all. So there's always 2 steps in between, very subtle differences, but the beginning and the end is always the same, how you collect the anterior nares swab. And by the way, we have collection charts, both in Spanish and English, all prepared on anterior nares collection that come from the CDC, just to mention that. And they all end the same, making sure that there is color where the control line should be, and then waiting for color to come up to see if the test is positive.
All right, thank you. Next question, will the Binax Now test be administered by our school staff? Will the results be recorded on an app?
Yes, typically the rapid antigen tests are administered by school staff. However, as we build testing programs for certain districts, there are a number of occasions where our medical assistants could administer a rapid test on site. Where we found that particularly useful would be, for instance, in an athletic program. And if we schedule a close contact sport PCR testing day, hypothetical on a Tuesday, and you need results back by Friday for the game, from time to time, people will miss those testing events. And so we provide the rapid antigen tests to the schools and the districts so they could administer those on a case-by-case basis.
Got it, thank you. We're in a very rural area. Would this slow the PCR result turnaround time down? That's what they're asking.
We don't believe so. As long as you have, I guess, Federal Express could be an option to get it up to Irving. You could be rural and be close to Irving and may actually be faster to drive it. It would depend upon the location, but it really shouldn't affect us at all.
Got
This
it.
is Diane. I'm sorry, Damon. I have
Go ahead.
a clarifying question for Achieve. So the information that you just shared saying that your staff would be available to assist with rapid antigen test collection, we were told that that was not an option. That AHM staff would be available only for PCR collection.
Well, so to clarify that is if we're on site, we equipped our medical assistants with rapid antigen tests. But typically we will not go out and administer only rapid antigen tests.
Okay, perfect. Thank you.
Thank you.
And the reason why is that we feel strongly that in general, they should only be used in the most extreme of circumstances and should not be the backbone of your testing program.
Got it. Thank you. I've been administering Binax Now tests for over a year. Will I have to go back through the training again?
Well, that's what I was trying to get at before. There are lots of similarities and there should be a great deal of comfort there. If you're still going to use the Binax Now, great. If you switch to the GenBody test, which appears to have a better sensitivity, yes, there'll be a little bit of retraining, but it's, as I said, the whole thing should take about 5 minutes.
Got it. This question here is dealing with parental consent. So I also already have my parental consent forms already signed. Will I have to do a digital sign every time I test?
No, we have a consent form that's valid for 12 months. And each state we work with is unique in the age of consent. I know California is 13, most states are 15 or some are 16. But what will happen is you'll register one time and then you're set.
Okay. What SIS systems or student information systems do you integrate with, if any?
Yes, currently with Crisis Go, we integrate with all student information systems across the country, and many ways to do that integration: one roster, direct integration, and SFTP. So anyway, but we do that with 16,000 schools today across the country.
And could you review really quickly, so your reporting system, what's the specific reporting system that you all, in terms of when someone tests with the Abbott Binax Now, what system would they report it in? Could you just review that really quickly?
Yes, the rapid antigen test, we're providing actual upload for that into the system. kind of like a self-service upload that will report to AHM into their system, as well as to update the records inside of the results portal with Crisis Go.
Got it. And the reason that question was asked is because the previous programs, folks have used the Rapid Texas app, and they just wanted to know if it was going to be the same one. But from based on what you just said, it would be a new system, or a different system rather.
Yes.
Well, we're actually doing it that way because obviously we're providing more comprehensive solutions that include PCR, and this way all of the testing solutions can be centralized.
Got it. Thank you. At the beginning of the presentation, the speaker stated that AHM will report results to dishes. Is that accurate?
Yes, that's accurate. We had a meeting this morning on that very subject, and we have a dashboard that they'll be privy to. And what will happen is the data will come out of Crisis Go, and we'll remap that and provide it to them in their desired format. That is correct.
Got it. Thank you, sir. Is the rapid test performed with deep invasive nose swab, or is it a shallow, non-invasive nose swab?
Shallow, just at the very front opening of the nostril, going in basically the length of the fluffy cotton tip.
Got it. This question is around seating charts. Are you able to upload seating charts?
I saw that question, and I just wondered, is this a way to double check students? Maybe I don't understand it, but I thought I would ask you for clarification.
Got it. We'll have to come back. I'll make a note of that one about the seating chart piece. And
thank you.
So that we can give a clearer response. Yeah, I think that's a question I hadn't heard yet. Going further down. So someone wants to know, and this is one I can answer, is the cost of the rapid test covered if we've been a part of the TEA testing program? So and this is a general announcement for everyone for clarity. All of the vendors, the four, not including Infinity because that's already free from FEMA, they will build dishes, and that is how it will be covered. And then whatever is spent will then be deducted from your allocated amount, which is posted on the TEA website. And so when you reach out to a vendor and you request PCR or an antigen test, whatever the cost of that is, you'll call them, you'll submit a form to us that we'll be putting out there this week so that we can reconcile their invoices with what you said that you've received. And then that amount will be deducted from your allocated amount for the remainder of the year. So that'll come out. So hopefully that answers that question. So you don't have to come out of pocket if you're a district. They'll bill dishes. Let me see.
If I may,
Yes.
There's a question that says, logistically, are we able to use only antigen with AHM and PCR with another provider? And I thought that might, if it's all right with you, I thought that might be a very good question to
go ahead.
into, if that's okay. Yeah, thank you. Charles, do you want to start?
I do. Yeah. So the terms of our agreement with dishes is such that that is the rule, that we can provide the rapid antigen test, hypothetical, a different laboratory to provide the PCR test. But I think Crisis Go is a differentiator in that equation, and that having that data and that dashboard is really very valuable. We're seeing districts spend anywhere from 160 to 500 man hours a week trying to manage that data. And by having all three tied together, the registration through Achieve and then the laboratory results pushing back and the integration with Crisis Go, it's there. So absolutely, yes. If someone wanted to order just rapid antigen tests from us, we're perfectly fine with that. But we would want to stress the value of the the relationship between the three entities to really provide a seamless and comprehensive COVID testing program for the districts.
And if it's all right, Charles, I would just like to add one more thing, and that is we know each other very well, and we work together all the time. So we're not three entities that are kind of just getting together for the first time for the point of this program. We're extended family and have very, very close working relationships.
Yes, thank you for that. Again, we've worked with Inform since the beginning of the pandemic, and we've been in crisis go now for several months as this testing has upticked again.
Thank you for that. And HAM folks, our HAM folks, if you see any more questions and you want to prioritize those as you're scrolling through, I see we have quite a few still. Feel free. We got about 10 minutes left. I'll throw this one out there, and then you guys, we can kind of throw them out and answer them as we go. Just want to make sure we get to as many as possible. Here's a question though. How will we know if our order is being processed? Someone said that they sent an email requesting some test kits on the 16th of September. How will they know? What's the time of getting back? Like, what does that look like?
The first day we were besieged with requests, but we have a full-time team dedicated to it, and I believe we're 100% caught up to date. There may have been an email or so that's missed, but we're on top of it. Typically, it takes us at the most 8 to 12 hours to respond.
Got it. Thank you, sir.
There's another question, if I may. For specimens collected by AHM, what is the manpower you have to go on site? What is the turnaround for your team to come and test? I thought that would be a good question for us to jump into. Again, Charles, if you lead off.
Sure. So what we ask is that the district estimate testing. And again, we found that every district is unique. And there's no cookie cutter approach to this, is that, you know, each district has their own testing vision, and we help them build their testing plan. Typically, it takes us 10 to 14 days to prepare to staff and to establish times of day and days of the week for the testing programs.
Okay, thank you. Anything else stood out to you all that you want to answer? And I'm still scrolling myself.
Yes, if I may jump in again.
Go ahead, sir.
If we have, thank you. If we have been, I'm glad I took the speed reading in 9th grade. If we have been contacted with Jeff Williams and chose the Binax over the Jane body, will we be placed on the list to receive the Binax, or do we have to resubmit? Also, how many will we receive on the first round?
We will attempt to fill every as quickly as possible, and absolutely any district could choose the Binax now, but they are again allocating, and as I stated earlier, we have 3 very large orders in and are promising an update again today from Abbott. But each district, they can choose the product that they'd like. Go back and just clarify everything. If they elect to use us for a Gen Body or Binax now only, that's perfectly fine with dishes. It's perfectly fine with us. If you want to wait for the Abbott product, that's entirely up to the school. The Gen Body is, as you heard from Dr. Lazarus, is probably clinically superior, and that manufacturer has great manufacturing capabilities. They can do up to 3 million in a day. They have a facility in Southern California, and product is readily available.
There's another good question that should go to Crisis Go. How would we report tests that are administered by school staff? And I think that what you're referring to here mostly are rapid antigen, unless I'm wrong. So Crisis Go, why don't you have that off?
Yes, I've been looking through the questions, a couple things that came up, and I'll first answer this one. We have a method for people to, the nursing staff to be able to upload tests that come from Walgreens, CVS, those types of things, so you can capture outside testing programs. We have a different form-driven tool to upload your antigen test results. And we also have, based upon the district and their desire, the ability for your staff members to upload test results directly through a form-driven tool. So 3 different ways that can happen. I've also tried to respond in the questions that were sent to people directly. So if you asked a Crisis Go question, it should be in there. And I want to bring out that what our main goal here is to help you surface the test results in your portal almost instantly after those lab results have gone out to parents and student, or parents and staff, as well as provided the call to you to help you understand from the lab that you've had a positive test. So we try to surface that for you so you can start on those processes immediately. So it's one of the biggest values to you, as well as getting all of the health information about that person in one spot so you can make a good decision on quarantine. So any other questions, feel free to email me at jims@crisisgo.com. I've had some people want to request a webinar, and we'll be glad to do that as well. Thank you.
There's also a question. Thank you. There's also a question, Charles. Who will be responsible for the shipping costs between the districts and your lab?
A chief health management is responsible for all shipping and transportation costs. In the arrangement with dishes, they administer the budget, and that's inclusive of our price with the state.
There's another good question that says, it's a 2-parter, Charles. Will the tests be delivered to us, or will we have to go and pick them up? And the second part of the question is also, do you have a biohazard company that will pick up the used supplies? So it's a 2-parter.
Okay, in that, with the rapid antigen tests, they're drop shipped to the district. We can drop ship to individual schools within that district, and we just develop a shipping manifest. Relating to the specimen collection kits, which is a vial and a swab and a biohazard bag. Those are drop shipped to the district, and in some cases can be drop shipped to specific schools within that district. Regarding the used antigen tests, we do not offer any biohazard collection. And again, with the PCR test, since that material, the sample, is going to the laboratory, those would be disposed of inside the laboratory.
There's another question that asks to clarify one more time the simplest way to order rapid tests for the district.
The best way to do that is to email Jeff Williams. His email address is in the materials that have been disseminated by Dishes and TEA, but it's jwilliams@achievhealthmanagement.com. So Jeff has a very large team that's supporting him in this initiative, and if you email, you should get a response at the latest 8 to 12 hours.
Great. We had Diana, I just want to tell you, didn't skip your question on purpose, but thank you for asking me to go back to it. And the question is, who is writing the doctor's order for the school nurse to perform the test as required by our nursing license in schools? We would need standing orders to test. Do you provide them?
Yes, we can. So in each state, we have a medical director. As Dr. Lazarus knows, we have a number of them on our team now. And if the district was able to get or prefers to work with a local physician, we're perfectly fine with that. But we will have a medical director associated with this for the blanket order for the PCR. And then also with the antigen tests, And the antigen tests are administered under the authority of the laboratory. And so, yeah, we're covered in that regard.
And
And
if I can
again,
just,
oh, I'm so sorry.
no,
Please.
go ahead, and then I'll because we're at time, but I want to put a button
No,
on the
please.
standing order piece. But go
No,
ahead,
no,
sir.
please, you jump in, please.
So for the standing order, I know this is a big question for nurses across our state. What we're going to do, and we're working internally to make sure we get this information out. We're going to work with each vendor around this specific topic of standing order, and we will have it all outlined and communicated out to all school districts so that you all know exactly what's what and what's standing, because we want to make sure that you all feel empowered and don't feel like anything is any of your licensures or anything is being threatened or in question. So we're going to make sure that you all have that information and what you need. So just want to throw that in there. But we are at time, so I will turn it back over one more time to our guest here at Achievement Health Management. If you guys wanted to close out with any final words, and then we'll conclude the webinar.
Well, this time, Charles, if I could just kick it off first.
Sure.
I just want to say thank you to you all. Thank you for such great questions. I know that Charles will say the same thing, and our friends at Crisis Go. This isn't the only time we're going to speak. We have direct lines all the time, and between now and the next time we have a formal interaction, we're completely accessible, and I'm sure that our names and email addresses will be published. Charles, back to you.
Thank you, Dr. Lazarus. Again, apologize for the technical error at the beginning of the call, but we're pleased and privileged to be able to serve the schools. Please contact us via email or telephone call. We understand that everybody's testing needs are unique, and opinions differ from district to district. So we're happy to help you in any way that we can. We're working fast on the rapid antigen tests. And again, with informed diagnostics and Crisis Go, we think, in fact, we believe we have a fantastic solution for COVID management. And we know we engage with districts and schools every day, and we know what you're going through. And the job alone is hard, but if we can make it easier for you, please don't hesitate to call on us, because we're here to serve you. Thank you.
Thank you.
All right. Thank you guys so much. We really appreciate you, our guests. Thank you, Dishes. We have a couple more webinars for the rest of the week. Thank you to all the participants. Any questions we didn't get to, we'll bucket them and get as much information out to schools as possible. You all have a great rest of your day, and thank you again.
Thank you very much.